Buenas tardes. Welcome, everyone. Welcome to the National Hispanic Pharmacists Association First Annual Conference. My name is Doctora Maria Hearns Rivas, and I am the president of NHPA. I am excited to share this moment with you all, and I would like to express gratitude to our sponsors, CVS, Walmart, Pharma, our NHPA board members, to the National Hispanic Health Foundation staff members, Dr. Elena Rios, President of the National Hispanic Medical Association, also AVI Productions, Mr. Jorge Monzon, who's helping us with all of the technology here today, and APHA, all without whom today this very moment would not be possible. Our agenda for today. I will provide a brief introduction to the organization. As a side note, for a more thorough introduction to the organization, please go to our website and view our webinar launch presentation from November 2018. Then we will move on to our panel members, who will provide a very unique glimpse of the needs of our Hispanic patients and the needs of those providing pharmacy-related services to nuestros pacientes, our patients. At the end, we will hold a Q&A session. Please stay for that very special topic. Our mission is to empower Hispanic pharmacists and other members to improve the health of Hispanic populations in collaborations with the public and private sector partners. Our vision is to be the lead pharmacy organization for improving the health of Hispanic populations in the United States. I would like to present to you our NHPA board members. Please wave. Thank you, board members. To all of our attendees today who are present here with us, please feel free to talk to our board members today after the meeting. And again, thank you, board members, for all of your efforts. Comentarios de mis pacientes, commentaries from my patients. Before moving forward, I want to talk about the backdrop to NHPA because I believe this is our common thread and the creation of NHPA has been long overdue. Very briefly about myself, I'm an ambulatory care clinical pharmacist in Northern California, and I manage a panel of about 1,500 Spanish-speaking patients with diabetes. In the organization I work for, I am a full-time ambulatory care clinical pharmacist, and within protocol, I manage and make any medication adjustments necessary to patients' diabetes and cardiovascular prevention-related medications. I believe that the reason why we're here today is because of the stories we hear from our Hispanic patients, the needs we see this community, and because we're all here because we want to take action to make the pharmacy-related services better for our Hispanic patients. These are some quotes from my own patients, and I believe that most of us in this room have had some sort of a version of these quotes from our very own patients. Pero doctora, la insulina me va a causar que me quede ciega. But doctor, the insulin is going to cause me to go blind. Pues no me tomo mi medicamento de la presión porque me siento bien. I don't take my blood pressure medication because I feel okay. Siento que estoy tomando mucho medicamento. ¿No me estarán causando daño en mis órganos? I feel like I'm taking a lot of medication. Isn't all that medication causing some damage to my organs? No, pues se me acabó mis pastillas y no sabía que tenía más rellenos en la farmacia. Oh, well, I ran out of pills and I didn't know I had more refills at the pharmacy. Siento que la metformina me cae mal en el estómago y mejor la dejé de tomar. I feel like the metformin causes me some stomach illness, and instead I just stopped taking it. Mi tía me recomendó un té de hierbas naturales y mejor dejé de tomar mi medicamento. Well, my aunt recommended me some herbal teas, and instead I just stopped taking my own medications. So as I mentioned already, these are just some of the quotes that I am sure we have all heard some version of from our Hispanic patients, and I believe that this is just the tip of the iceberg. So I will briefly share with you some of the highlights from our launch of the webinar that we had in November 2018. I invite you all to take a look at the full video and take a look at, also hear the commentaries that we had at the end of that session. So some of the highlights are, as of 2016, Hispanics are now the largest ethnic or racial minority in the United States. Another very important one is, according to the Department of Labor, Hispanic pharmacists make up only 4.5% of the 342,000 employed pharmacists. Another very important one, I believe, since 1990, there has been a 133.4% increase in the number of those who speak Spanish at home. Another one is only 7.2% of pharmacy school applications are filed by Hispanic or Latino students. Another one, and really the reason why NHPA is so important, it's because of the health disparities that our patients are facing. We need to help address these health disparities, and through helping our patients better understand their medications and better understand the importance of adherence to these medications is why NHPA is so important. For example, Latinos have higher death rates compared to non-Hispanic whites. Diabetes, 51%, chronic liver disease, cirrhosis, 48%, essential hypertension, hypertensive renal disease, 8%. So earlier, when I gave the quotes about those quotes that I've heard from my patients, one of the other things that we need to acknowledge and really realize is that the services that we provide to our patients, it's not just, that we speak the common language, but we understand the culture. We understand the kinds of barriers that they have, and through that understanding, we can further help them overcome those barriers so that they can become adherent to those very important medications to help address the very prevalent health disparities that they're currently experiencing. So now that you're all here, you're all probably really excited about, how do I join NHPA? And what is the structure and what are the benefits? So let's talk briefly about that. So this is the National Hispanic Pharmacists Association organizational structure. So we have a corporate advisory committee who advises our board of directors, who then provides guidance to our amazing National Hispanic Health Foundation staff, who help execute membership programs and development. In terms of benefits, we're just getting started. We have membership that ranges from pharmacist, resident, pharmacy student, pharmacy technician, pre-pharmacy students. We believe it's very important to enhance a pipeline so that we can help recruit future Hispanic pharmacists. And then also in terms of programs, today, our annual conference, we're also looking into having regional networking events. Student programs, we're actively currently working on launching a scholarship for all of our student members. In addition to, the pipeline is very important. So in terms of our pre-pharmacy members, really developing a webinar series where we help them how to become a competitive applicant for schools of pharmacy and how to be successful and actually get accepted to school of pharmacy. And then we will also have a Familia mentorship program, where it's really just a series from pre-pharmacy, pharmacy, resident, pharmacist sort of group that just moves together in terms of the mentorship. So if you love mentoring students or others, please join us. We'd be happy to have you. And then we're still developing, so we're looking for sponsors for others to join our corporate advisory, to become a corporate advisory member. And so if you have any more questions, please let us know. And I do believe that we have our contact information on those flyers. So to get started with our first panel member, Doctora Sandra Leal, PharmD, PhD, DE, FA, PHA. She's the Chief Executive Officer, APHA Board of Trustees. Her School of Pharmacy is from the University of Colorado School of Pharmacy, and she is from Nogales, Arizona. And what I will do, I will introduce our panel members. I will provide the sets of questions. They will have about 5 to 7 minutes to answer the questions, and then we'll move through the rest of our panel members. So the first question for Doctora Leal, what is your experience in working with Hispanic patients, and what are some of the biggest challenges they face when it comes to their health and their medications? The other one, I'll just go ahead, 3. Okay. What are some of the challenges pharmacists face when supporting their Hispanic and or Spanish-speaking patients? And finally, what are some of your proposed solutions?
All right, so just 1, 2, 3. You're going to have to remind me of the
You
question.
let me know.
Okay. So the first one was the patients?
The challenges that they face.
The challenge. Oh, okay, wow. So, well, it's a pleasure to be here. I'm so excited to be part of this first annual meeting here at APHA, and it's a special year for me. I'm running for president of APHA, so I had to say that, so I hope that you vote. If you received your ballots yesterday, it's exciting to be considered for that position, and I am so grateful for the opportunity to be here, to become a pharmacist. I grew up in Nogales, Arizona, and my parents don't speak English. They never spoken English because we lived on the border. And so whenever we went to seek healthcare, one of the challenges in Nogales was that a lot of the providers there spoke English only. So they never had an accessible provider that they could really comfortably go in and see. So we would go into Mexico and we would go into the pharmacy, and that's who we would seek care from. So that's what I knew to be the primary care provider for us. And so that's why I wanted to become a pharmacist, because I knew there were challenges to access care, and I wanted to become a provider that actually spoke Spanish, so I could communicate with the patients that I was working with. And so, as you well know, diabetes is very, very, it happens so much in our culture that it was just so challenging that I would see my aunts and uncles really have significant barriers to care, understanding everything you said. All those quotes, I think I've heard them multiple times. I ended up working at El Rio Health Center. It's a large community health center in Tucson, Arizona, and it was the significant benefit of having been a Hispanic provider is that I could speak to patients in their language. I would probably spend 75% of my day speaking in Spanish, and people would seek me out because they were trying to find a Spanish-speaking provider. So that was great. So I wanted to thank the University of Colorado. Kathy Jarvis is back there. It was such a wonderful school for me. They really helped support me, and I think, I'm very grateful to the university for having given me the opportunity. They actually provided a Skaggs scholarship because Mr. Skaggs wanted to provide opportunities for, any minority pharmacists actually have the opportunity to have a scholarship to go to school and then go back and practice in the communities that they would serve that would represent, the patients that they were serving. So barriers for the patients that I see even today. So now I'm at Symphonia RX. I'm the CEO of that, and it's a medication therapy management company that we serve patients across the country. And language barriers, cost barriers, access to understanding of just information. The system is so complex. It's so fragmented. There's just so many opportunities to not be successful, even when you're trying to do everything to be successful. So those are some of the biggest challenges I think our patients see, any patient, but I always put myself in patient shoes. I'm like, at least I can speak the language. I understand healthcare. And even if you have every opportunity, you still have challenges in healthcare. So now you have somebody who is Hispanic who doesn't speak the language, maybe doesn't understand the system. Cost, as you well know, is just skyrocketing with affordability of prescriptions, of co-pays. So those are all the challenges, plus the cultural aspects of it. If people have child care issues, or, if they can't leave their kids at home, one of the benefits, I would see families together sometimes, which is a good thing. So leverage what we know about the culture and then try to embrace it and bring it in. But there were just so many barriers built into that it's a significant challenge. So I love this. I love what you're doing, because I think we need more of these types of initiatives so that we're encouraging people to apply to schools. And so I feel very lucky to have done that. So I will go to question number 2.
Great. What are some of the challenges pharmacists face when helping and supporting their Hispanic and or Spanish-speaking patients?
So, wow, there's so many opportunities. I mean, a lot of the initiatives that I worked on in my career have been to provide that access. We think a lot about people coming to us, and that doesn't work, right? There's so many barriers, but how do we reach people when they don't even know they have to be reached? So I love working at El Rio. It's the best practice in the world, very, very advanced practice for pharmacists. We could do collaborative practice, prescribed, but for every patient I saw, there were 2 or 3 or 4 waiting, and we could never see enough patients to meet the demands. So, I really looked at technology solutions and being able to reach people the way they can be reached. So, we use a lot of telephonic, telehealth. We send people to the community, working with, public health. I went to public health school because I thought, wow, there's just too many problems that I keep seeing that people are experiencing every day when they walk in the door. So that's a challenge. How do you deal with that? Well, try to fix a system, right? You try to fix a system, you try to do policy change within the system, but then you realize, oh my gosh, people are accessing multiple systems. And then being in Nogales, working in Nogales or in Tucson, we also saw people going into Mexico and coming back because guess what? Medication is more affordable. They can actually speak to the provider there in Spanish. So then you have fragmentation where you have people going there, coming here, trying to access any way they can the services that they need. So it's just trying to build that ability to provide the services in a way that people need them when they need them in an accessible way. So I've always loved the safety nets. There's a 340B drug pricing program that we leveraged. There was, promotoras de salud. We worked with local health promoters to go out to people's homes. We would create opportunities. I would teach I'm a certified diabetes educator, so teach classes not in a health center, but actually in the libraries, or we would go to the park and have a carne asada and teach people how to actually cook food that they want to eat in a healthy way, right? You can't tell somebody to stop eating their tortillas and think that's a realistic expectation. You can't do that. You just stop doing that. It doesn't work. But maybe you say instead of 3 or 4, 1 or 2. Instead of 6 tamales, 1 or 2. So just like really thinking about the cultural aspects of how to, work with people where they're at. And then, the lady this morning at the opening session, she said, what is that little inch? Start with that inch before you go that mile. Yeah. An inch is a cinch. A mile takes a while. So that's what you have to do. Build trust with people. Once they see outcomes and benefits of what you're doing when you're working with them, it goes a long way. So the trust, the relationship, the language, really understanding the culture and giving perspective to that. I think those are some of the things that have very effectively worked in the practice that I've been in.
And last question. And I think you already touched upon these, but if you have any additional ones, what are some of your proposed solutions to these challenges?
Well, I think this is one of the solutions that, you're planting the seed on how to recruit Hispanic patients, any culture that we're seeing, any language support that we have for patients, trying to get the types of practitioners that actually serve the needs of the community. And I think that's a great opportunity. But I also think about there's not one solution to anything, right? It's leveraging different solutions, working together, collaborating, thinking about technology, but some people can't afford technology. Okay, so what can we do instead? There's so many opportunities with health literacy and creating materials that are specifically for the culture and not trying to just do a one-size-fits-all because it doesn't. One size does not fit all for any culture that you're working with. I'll give you an example. I worked at El Rio Health Center, so we have patients that are Hispanic. But if we have somebody who's deaf, wow, you totally have to restructure the system to help that person because that is a person that is also challenged. So you can't apply a solution to a population. You just have to think about the challenges for that population and then try to build that support system to help that individual patient. But just being aware of that a lot of times is half the battle. Right? Acknowledging that there's differences and then trying to figure out how to work with those differences, that's half the battle. And there's a ton of people out there. We have so many relationships with colleges of pharmacy where we actually leverage the students to come in and help with projects, quality improvement, depression screenings that we've been able to, incorporate as part of our practice, which is great for students to get that exposure, but it doesn't necessarily cost more for the system. It's like a win-win. So definitely using student relationships, partnering with colleges colleges of pharmacy, trying to create that opportunity, and then that exposure makes a big difference. One of my favorite things that I do is I teach at the College of Pharmacy at the University of Arizona, and they have a rotation class right before they go out on their experiential experiences. And it's a class that I specifically teach on working with underserved populations and safety net, just so people have an awareness of the challenges that they're going to experience when they go out and practice, and just to have them be aware that that's something that they really need to start thinking about, because they're going to see challenges that probably have never even considered when they're in pharmacy school. So those are, again, just things that we can all do to really help the incoming students and what they're going to see in the practice. I could go on for hours, but I don't want to, because I want to make sure everybody else has an opportunity.
Thank you so much, Dr. Leal, for that very unique perspective. Our next panel member is Dr. Diana DeVore. She is a PGY1 ambulatory care pharmacy resident at USC School of Pharmacy. She graduated from Touro University College of California, and she is from Redwood City, California. So, Dr. DeVore, as a pharmacy resident, what are some of the challenges you have observed that your Hispanic and or Spanish-speaking patients have?
I would say health literacy is one of the biggest challenges. One thing that really gets me off guard is a lot of the instructions on the prescription bottle, the patients don't know how to read. And sometimes there is availability to have it in Spanish for them, but the providers don't know that pharmacy actually has that availability. So my job as a clinical pharmacist, when I do a lot of safety net, chronic disease management and diabetes and hypertension. And so my job is not only assessing if they're on the right medication dose, my job is also to see if they're actually taking their medications appropriately. And so if there is a miscommunication or misunderstanding, me as a pharmacist, when I have that 15, 20-minute visit with them, I can actually address that really quickly. So that's one of the barriers that I've seen, health literacy and understanding how to take the medication when they leave the clinic visit.
Okay. And for this same group of, what are some of the challenges that new pharmacy graduates face when helping English as a second language ESL patient and or Hispanic Spanish-speaking patients?
So interpreter services are not always available. That's what I've noticed. And new graduates, when that service is not available for Spanish-speaking patients, it makes it very hard. And sometimes they're just getting by. So again, there's a lack of communication, and because of that lack of communication, our patients fall through the loops and end up with leg amputations or end up losing their eyesight by the time they actually get that help, or they're admitted to the hospital, and that transition of care from inpatient to outpatient, they're on heart failure and they get admitted for heart failure exacerbation, and they're supposed to take their Lasix a certain time of the day or understand how they're supposed to take it. And if they don't take it, it can actually be worse and be admitted again. So I feel because of that lack of language availability for providers, it makes it hard for patients when they leave the hospital or when they leave our clinic.
And what are some of your proposed solutions?
One of the proposed solutions, I see that medicine is moving towards having scribes. So like pre-medicine students being scribes for clinicians to help them with charting. And for me, that's a big component as a primary care clinical pharmacist, charting. So if we can actually create kind of like a pipeline, create opportunities for pre-pharmacy students to be in the clinic and help chart, I think it gives them an early exposure. So that's one proposed solution. Having more interpreter services available, not only in phone but also in person, allows for a group conversation when family members come in with their daughter and they're also Spanish speaking. having that group conversation with an interpreter actually makes it easier as well. I think those are some of the proposed solutions I think would be beneficial.
Great, thank you so much. Our third panel member is Nancy Ramirez. She's currently a Doctor of Pharmacy candidate for the class of 2021 at the University of California, San Francisco School of Pharmacy. She is from Orange Cove, California. So first question, Nancy. What are some of the challenges Hispanic and or underrepresented students face when applying to pharmacy school?
Many students, like myself, are first-generation students. One of the problems that I came across when I was applying to pharmacy school was not having the proper guidance. For example, I didn't really know even really where to start. I was very unfamiliar with the entire process from PharmCast to applying to the PCAT. So that made it very difficult. And in some situations, I feel like it can even limit the student from wanting to go further in the process. For example, when I was applying both to undergraduate and pharmacy school, I wasn't really even able to help or receive help from family because this was something that I had to do by myself. So my family members or my parents weren't really able to help because they didn't really understand the process. And even on top of that, they weren't even familiar with pharmacy at all. Additionally, I felt that there was also like a language barrier. Even if they did want to help and they did want to seek out more information to try to help me, there was always that language barrier that existed where they couldn't help me get more information about that. And I feel another barrier that I had when applying to pharmacy school, was a financial burden, because when I looked at the amount of loans that I had to take out, it was comparable to the amount of the income that my family made. So that was very discouraging, to see like how much you had to take out, like how are you going to repay this back? So looking at all of those aspects, it's very difficult to kind of proceed just because it's not something where you don't really have help. It's something that you kind of have to take on all by yourself. So,
thank you for that. Second question, and for this same group of students, what are some of the challenges they face while in pharmacy school?
So that's something similar. So in my class, I've noticed that a lot of my classmates have already healthcare professionals as like a family member that help them along with their educational timeline. So they tell them, oh, this is when you apply for internships, where you should look, how to study even. And as a first generation student who doesn't have that, it's difficult. You kind of feel sometimes like you're always a step behind, and you sometimes feel like you have to work twice as hard just to be at the same level. But I feel like as a pharmacy student, that's one of the biggest issues that I see. When you're moving from, your predominantly Hispanic community and you're going somewhere that's completely different, that's other issues that, nobody really tells you about, and you have to kind of deal with that on top of school. And again, with the, having a financial burden, you have to take out more loans. I feel like a lot than other students, just because like other students have family members that can help them. Whereas for example, my family, they couldn't help me just because they had other financial responsibilities back at home. And even then, sometimes you as a student have to be a financial supporter for your own family back at home, on top of, trying to keep up with yourself during school. So.
And last question, what are some of your proposed solutions?
So some of my proposed solutions, one I would say would be advocacy, advocating to undergraduate schools, even as early on as high school, letting them know that there are places where they can go to receive help, to help them apply to school, even when you're in pharmacy school, to help them with any kind of advice that they might need is a big one. I also think that having mentorships is really important. Having somebody there, even just to ask a question on a certain class or where to look for internships is huge, because you can't really relate to your other classmates because they don't have the same background or that same story as you do. So I feel like having a mentor there, somebody that you can trust and somebody that you can relate to, is really important. Additionally, I feel like having scholarship opportunities is also would be a big burden, lift the financial burden. Just because, like I said, a lot of students like myself have to take out a lot of loans, and that can be very discouraging. So even with, like, for example, DACA students, they aren't able to qualify for financial aid, so they have to seek private loans with high interest rates. And so I feel like having scholarship opportunities that really tailor to Hispanics, underrepresented, and DACA students would definitely help. And then overall, I feel like just having a solid support system is important. You want to be able to rely on somebody to help you get to that end goal of becoming a pharmacist, and then even going further, getting residency and so forth. And I feel like with doing all these things, you will ensure the success of a student.
Thank you, Nancy, so much. Thank you. And for our last panel member, but certainly not least, is Randy Martinez. He is our Corporate Advisory Committee Chair for the National Hispanic Pharmacists Association, and he's also the Strategic Diversity Manager Director at CVS Health. First question to Mr. Martinez. How has the market landscape changed over the years, and why was CVS interested in helping establish NHPA?
Great. Well, thank you, everyone, for being here this evening. Thanks for having this panel. Quite honestly, I wasn't prepared to sit on the panel. I didn't realize I was sitting on the panel today. I missed that boat somewhere. It's interesting. I mean, a lot of the work that I do is, we look at demographics, the changing demographics. But not only the changing demographics, but really the dynamics inside that changing demographics. And so the conversations I have with our pharmacy operations teams and our recruiting teams really are around, we are growing as an organization, but we don't have the representation for the changing demographics, right? And I'm going to go directly to language competency. That's been a challenge for us, right? And then, more so, we have a Hispanic strategy through our CVS EMAS initiative. And so, how can we grow aggressively with a, focused on a target market, the segment, population segment, and not have Spanish-speaking pharmacists, right? And when you look at the data, I mean, there's, against, the 4.5% against the number of pharmacists is about 15,000, right? There are about 243,000 pharmacists, 15,000 Hispanic pharmacists, 15,000 against the 58 million Hispanics. That's 0.03%, right? Representing. So there's a huge gap there. So the solution to that for us was, let's partner with a community organization, and let's begin to explore how we can create an organization that will tailor and accommodate the needs of that pathways to pharmacy for students in urban communities, right? And help them find solutions such as financial aid and guidance, and educating the middle schools and high schools in urban communities about those opportunities. And then let us as a company work with organizations like NHPA NHMA and cultivate that organization to ensure that, we are building a future pipeline, into that market, right? And so the goal for us in partnering with Walmart and pharma was looking at those, we're in the marketplace in business, we're competitors. But we had to take a step back and say, hey, guys, let's be enablers here. Let's work together and fund this project together so that we can build an organization that will be the leading organization to ensure we build a pipeline and best practices on Hispanic health pharmacy care delivery to the changing and growing demographics of the Hispanic community.
Okay, thank you. Next question, and I think you already touched upon some of this. In hearing about the challenges from our panelists, from skilled pharmacists to student pharmacists et al., how can CVS or any other company help us overcome patients' pharmacy-related determinants of health?
Oh man, that's a tough question. So, look, what I can tell you is, based on the work that I do with our pharmacy teams and I work with Minute Clinic also, right? When it comes from the perspective of the patient, especially Hispanic patients, how do we help create access? How do we help solve for access, cost, and quality, right? That's what we focus on in what we do every day. So we're always working to solve for that, right? And I missed the second part of your question.
So how can CVS or any other company help us overcome patients' pharmacy-related determinants of health?
Right. So, well, look, I will tell you that we at CVS have a program called Project Health. It's a $20 million a year investment into biometric screenings. And we go into predominantly low-income Latino communities and African-American communities. And we run free biometric screenings. We have a pharmacist and a physician who's there to explain to the patients what their findings are. And then we provide what's called an independent health access plan, which in turn, that whether they have health insurance or not, we guide them to a primary care doctor and ensure that they go to that doctor with a plan, kind of really describing what they just learned about their health, right? It could be diabetes, hypertension, whatever the condition is. In that moment, we recommend the next step for them. So that's one way that we're solving for that, right? And then building cultural competence within our Minute Clinic division and within our pharmacy operations teams, right? And by organizing and supporting the launch of this organization is what we're trying to do to solve for, ensuring that we understand what is happening in terms of health disease states in the marketplace so that we can solve for that. So,
thank you. And last question. What are some of the benefits for companies to join and support NHPA?
Are you kidding me? You can be a founding member for $25,000. The benefit is this, if CVS considers itself a pharmacy innovation company. We're constantly innovating, finding new ways to capture market share, to provide better care, both from the healthcare and pharmacy delivery. And so, the benefit to companies, it's, let's come together and and change the marketplace. I mean, for our teams who are here today on pharmacy recruiting, this is an opportunity for us to build a pipeline into the future and change change the demographics or to build more pharmacists within the workforce, right? And as we see that growing demographics, I mean, it's by 2050 the Hispanic population is supposed to be at 119 million. We need to come together and give our part to ensuring that we're changing this workforce. So,
excellent. Thank you so much.
Great.
So I want to give a round of applause to our panel members. I also want to, again, acknowledge our corporate supporters, again, without whom, NHPA would not exist. So thank you so much to all of our corporate sponsors. So if you want to connect with us, here is a way to connect with us. I also want to mention that we are currently running a membership drive, and if you join today, you get a really cool lapel pin. You'll also get added to our newsletter listserv, get connected, etc. as we move forward. So please join us. Here's our contact information. I believe it's also on the flyers. And now we're ready for the Q&A session. So for anyone who has any questions, if I could have, here we go. We're going to start a line. No, we're not going to do a line. Okay, so Ben will bring it over. Go ahead.
My question really could go to any of you, but Nancy, since you addressed it, I'm really curious as to how did you come to have a deep enough understanding of pharmacy to want to become a pharmacist? And then what factors motivated you to really overcome that fear of the cost and the challenges that you would face?
Yeah, so I actually wanted to do health. I didn't know what I wanted to do in high school. I was just really interested in it. But so I did myself a lot of research because I didn't know a lot about it when I was in high school, and even in high school, I didn't really there wasn't anybody to go to try to get more information about that. But I did a lot of research, and I came across an organization called HCOP, Health Career Opportunity Program at Fresno State. And through them, actually, they're the ones who helped me kind of go across each step, like on what I needed to do, what tests that I needed to take, throughout the entire time through undergraduate school. So I did a lot of shadowing as well through them that they helped me get, and I was able to ask questions like what about a financial aspect of it, and they were just a lot of the pharmacists that I was able to shadow were very supportive, and they just kind of don't look at that part of it. It's just something that you have to push through. So unfortunately, that organization isn't there anymore. But without them, I wouldn't be in pharmacy school.
Thank you. Anyone else? So we have a question over here.
Hi. Good evening. My name is Nicole Santiago. I'm actually from the USF College of Pharmacy in Tampa, Florida. Originally, I'm from Puerto Rico. And thankfully, in my college, we actually have a chapter called the Hispanic Association of Pharmacists. And one of the things that we do is actually offer seminars and just kind of Spanish lessons for all of our interdisciplinary students. So we're talking nursing, medicine, especially since some of them go to do some mission trips in Panama and Dominican Republic and other countries as such. What do you believe that is also another approach or another thing that you could do? Just kind of, in the Hispanic advocacy, teach current pharmacists and current, health professionals, to at least attempt to create the beginning of a conversation, so that at least even if you're not able to communicate all of your medical knowledge in their native language, at least create that rapport with their patients.
That is an excellent question. So there are not enough Hispanic pharmacists for our growing Hispanic population, and you bring up a very good point, and that is the importance of just cultural competency. How can you, as who you are, even if you don't speak Spanish, how can one better provide services to our Spanish-speaking populations? So it is on our wish list, it is on our to-do list, in order to provide sort of a comprehensive sort of cultural competency for our Hispanic population to better enable our current pharmacists. How can you equip yourself with what you need to provide that cultural competency? Because it's not really just about the language, right? It's about, acknowledging that you can't take away tortillas if you're counseling someone on diabetes. Acknowledging that they may not really, like, the directions are there in Spanish, but even if they're there in Spanish, something's gonna fall through the cracks, and instead of taking one tablet twice a day, they might take 2 tablets once a day. I've seen it quite often. So just kind of picking up on those nuances that are very much needed, I think that is, it's in the works. Thank you. Any other questions?
Good evening. My name is Lourdes Planas. I'm associate professor at the University of Oklahoma, College of Pharmacy. I'm very, very thrilled to be here this evening. I guess I have a 2-part question. Being in Oklahoma, we are not a border state, but at the same time, people don't usually think about Oklahoma as having a high Hispanic population, but as everywhere else in the country, it's been growing. Right now, our public school system in Oklahoma City is 54% Hispanic. And again, you think of Oklahoma, most people don't think about that. So it's a huge growing population, but our student body, like out of 86 students, we usually have 2, maybe 3 students who are Hispanic. Out of 86, that's really, really tragic. But we do have this growing, elementary and high school population. So what are some thoughts that you have on increasing, or some strategies and partnerships for improving outreach to schools, community colleges, to try to encourage more Hispanic students to apply to pharmacy school?
That is a great question. Oh, go ahead, Diana, or Dr. Leon.
Yeah, we'll both answer it. But so one of the things that came to mind as somebody was speaking here, so I want to I was PTSD with what you were experiencing, like everything you said, right? Like, what's the form? What's the FAFSA? You need your parents' income tax to apply for all of that. And there was nobody to help. I mean, it was crazy. I don't know. Some days I wake up and I don't know how I got here. It's such a challenge. So I just seriously, you repeated my experience. But one of the things at the University of Arizona that they've done tremendously effectively is that they started what they call Farm Camp. So it's a pharmacy camp. So essentially the school has a summer camp where they go and outreach to local schools, and they primarily target schools with diversity to be able to bring in kids to the College of Pharmacy for a week during the summer, where they expose them to what it is to be a pharmacist. So it's amazing. We actually had the first graduate from that program graduate pharmacy school, and she's wonderful. She's like a regional manager now so awesome. But those types of programs of outreach, exposing them to what you could actually do, that was amazing. And so one of the sites they would stop at to see us actually now is El Rio Health Center. So, one of the things they would do is they would see a pharmacist in a different kind of practice, and they would see somebody that looked like them and talked like them. And, I would ask, hey, how many of your family members have diabetes? And, obviously a lot of them raise their hands. The other thing that we're doing, so it's that partnership with a college to do outreach early. We're talking about maybe middle school. So start early, plant the seed, and then expose them to what that could be. The other thing that we do, and this is a really interesting concept, there's a high school in Tucson that actually has part of the curriculum for the high school students is to go and do an FTE type of position within our company, so at Sinfonia. So every day of the week, we have 2 students from the from the high school that get placed in this, so they do work. One day of their curriculum, and then the other day they do their high school curriculum. And we have hired so many of those students that come out. They have started as, what would be maybe a pharmacy technician or right out of high school because they were working all through high school. And some of them have gone on, and one of them is now our HR director. Another one's going through pharmacy school. So it essentially created, the opportunity for them to be exposed and then have mentors around you that you would otherwise not even know that you could access or reach. So it's just those creative opportunities to think outside the box. You really think about who we can tap into to create the diversity that you need. So from a college perspective, Farm Camp, there's a great model out there with U of A, and then for high schools and other opportunities to think about how to partner with corporations that could create that bridge to get there.
I want to say I was also first to go to college in my family, and I encountered a lot of the same things that you have. Thank you. And I feel like being able to go through, I went through community college and then the whole ordeal of applying to undergrad. And it wasn't until I was able to take time off and do clinical community-based participatory research at San Francisco General Hospital, I actually figured out what a clinical pharmacist does. And I was like, oh, I thought I was, behind like retail, but I never knew that a pharmacist could also do the same things as a primary care provider can. And I think having that exposure at an earlier age would create so many open door opportunities for students because they may be interested in primary care and they just see the physician track rep and they don't see that until later on. And I feel like pharmacy is such a big profession. Like people go into oncology, they go into psych, they go into pain management, but a lot of kids don't know that. And I feel like where I went to Toro Pharmacy School, they have this Teen Life Conference, which is a whole day event, and it exposes them to the pharmacy profession, medicine profession. But I feel that exposure we pick up the students from the high school and give them a day of what it is to be a pharmacy student and what you can do. I wish I had that in high school. So I think that would definitely help as well.
So today, I've been to a few meetings today, and I've heard of different programs that organizations and companies have, and we have one called Pathways to Pharmacy, and I know our corporate partners have their own programs too, and that's where the relationship and with NHPA and the opportunity to take inventory of all the different programs that all of us who are touching this organization can, we can take that inventory and see how we can take that and then go into these urban markets, right, and talk about, drive some awareness in middle school about the Pathways to Pharmacy School. We're just not doing a great job. We do have that program, Pathways to Pharmacy. I know we've touched over 1 million lives, but when it comes to this discussion, I'm not sure we've touched the right lives about, that, right? So, and these are consistent challenges that I've been hearing since we started going down this road, about forming the organization. So, and that we heard that loud and clear when we did the ideation session a few years ago. So.
Much for your responses. I had mentioned that I had a second question. As a social and administrative pharmacy researcher, it's very exciting to think about opportunities not only to conduct evaluation research of all the different programs that you provide and develop new programs so that and publish and receive, submit for funding and then do the projects and publish so more people can learn about them. So I would encourage you and everyone in this room to really be thinking about those things. We need to get research funded and out there and scalable models and figure out ways to get them expanded. But one other thought that I would challenge everyone to think about is best practices papers, because as you, for example, talk about all these programs about being able to recruit students, then if there are schools that are struggling or communities that are struggling, if we have a way to publish those protocols or however the programs are done, outcomes, tracking students, and that can be a white paper or something like that. That can be something that I think everyone will benefit from learning about the accomplishments and the barriers, along the way, the obstacles and how people overcame them.
Absolutely.
So that's more a comment, I guess, than a question.
No, that's a perfect comment, and it's really about, collaboration across, everyone, and the more that we share, the better that we will all be. Next question.
I just wanted to share, my name is Mario Jimenez. I'm the Director of Diversity Initiatives at West University College of Pharmacy in Pomona, California. And what we do, just to share amongst all of you, is we have a farm day at our, so we bring about over, first semester, almost 1,200 high school students. And we try to break that myth that we're not just counting pills and pouring liquid, because that's their mindset. And so we can break that, let them know that our new today are students that are learning all these new clinical skills, such as, glucose testing. We do it with the kids, and blood pressure monitoring. It kind of breaks that myth we actually do as pharmacists. So that's a program that we have. Also, there's a program called the SHPEP program. I don't know if many of you are aware with that, but it's a summer health professionals education program, and we bring in 80 students from across the U.S., both underserved minorities, blacks, and Hispanic. And so we're educating them not only in pharmacy, but since we have 9 health science schools on our campus, we expose them to medicine, podiatry, dentistry, optometry, and pharmacy. So that's something that maybe some of the other pharmacy colleges can learn to apply, because we have 12 schools across the nation that has this program, ourselves and UCLA, but UCLA doesn't have a pharmacy program, so we're fortunate to be able to do this. We do this will be our 3rd year being able to host these students. So I just wanted to share that with everybody.
Thank you.
So, Mario, I was going to say, that's a great program, and those are community-based programs and community-based outreach that I think a lot of schools and organizations here can engage in. And what that reminded me, the last few years, we've been doing some work with City of Hope. City of Hope Hospital it's like, I think San Bernardino, right? Right. Once a year, they host this huge community fair where they bring out their doctors, pharmacists, researchers, and they do mass outreach to middle school and high school. And parents show up with Hispanic students because it's predominantly Latino market community. And they spend the whole day educating students and the parents about the pathways to research or oncology or medicine or pharmacy. So, at the same time, I think, we all need to do a better job of really, creating that level of community awareness, so that we can get that message out and then hopefully partner with NHMA. So.
And then we have 2 more questions.
My name is Dr. Morales of Western University Health Science. Just to emphasize the misunderstanding of our profession from our own Latinos, the first generations, not understanding that we do quite a few things in the pharmacy, like diabetes, anti-coag, making them understand that we're an integral part of the system. Do you see that we should, some way, shape, form, reach out to the parents out there and make them understand that pharmacists are not like the ones in Mexico, just giving out medications, where we're making clinical decisions that are going to make the outcomes far more positive? Have you seen that? Do you feel that that could be a major stigma that's not pushing Latinos into the profession?
So I'll go ahead and add a brief comment, or if anyone else.
Well, my mom still doesn't know what I do. That's her. She's like, "What do you do? You're a pharmacist and you don't work in a pharmacy dispensing." So I have to bring her and show her. Now, I've changed paths into this. Now she's like, "What are you doing at APHA?" So it does take a lot of education. So it's as much, you do have to go and outreach to parents. But you know what's helped the most? Just actually having role models, mentoring people. I think I probably influenced my community more with my cousins, and now they want to go to college because they actually saw a path that it was possible because they know somebody who did it. That by itself broke down a lot of barriers. So my brothers, because they were like, "What? You're going to go to college? I'm going to go to college." So my brothers are both, they are MBAs, they have degrees. Before I went to college, it was never in our, it was nothing that they ever considered. And my mom, in fact, she didn't even want me to go to college because I was, the only daughter. She was afraid what's going to happen. So it does take, it takes that, taking that step and then just sharing your experience, what we're doing, sharing, mentoring others, and showing that this is possible. That sometimes is the most significant example that you can share with a community, so that they know you came just from the same place they did, and somehow you made it. And yes, it's possible. And now you actually connect, like what you said, finding a mentor that can help you. That's a significant, you take down a barrier for somebody that otherwise wouldn't have known this was even an option.
She's doing this. So people have had a whole change of attitude toward pharmacy. They go out there and they say, ¿Puede ser eso? ¿El boticario puede ser eso? I mean, they're stunned that we can do the change of the medications, adjust their insulin, adjust their MRIs based on certain values. And they're very impressed that we can do this. And they go like, why can't they do that in Mexico? Because we're doctors here. We're one level a lot higher than the average pharmacist or clinician that's in Mexico. Changing that perception will help us advance our profession farther along for Latinos, because Latinos look at this as, ¿qué está haciendo? Dale tabletas es todo. But here we're giving them good information, they understand the disease, and they have positive outcomes. And they get the stigma of eating two tortillas. Puedes tomar una tortilla. I am a little more stricter than you. But I just want to say that we have to first work on the first generations, make them understand this profession is a very important part to the healthcare team. And the only way we do that is to teach them that we are doing this, and we need to make that effort. I'm a pharmacist that has Parkinson's, and it's very difficult for me to relay this like I used to be able to do it. But to me, guys, we have to work hard to make our Latino brethren understand this profession is very, very, very special. And we can do so much good out there. But we have to change our stigma, because they think of us as a person in the back just counting pills. No, we're more than that. And we need to make this organization is a perfect example of how we can change it. And I'm really, really excited for this, because again, this is something that's been coming around for a long time. I've always heard the situation that, we don't have Latinos to be able to talk to, talk to a patient and make them understand the medication, therapies, and stuff like that. But just taking those 5 or 10 minutes, making them understand that, or more important, like you said, determining that they can't read. Because you assume they're Latino, they speak Spanish, they must read Spanish. No, they don't. When you see a little number on their top of the cap of their bottles, you know they're trying to figure out how to take their medication. That's the one I take 1 tablet. That's the one I take 2 tablets, because they know numbers. So we assume too much. Again, the profession needs to promote this profession in a positive way, and I think this organization is a good start. And I'm really proud of what you guys are doing, and hopefully I can help you get to the next level in California, because again, there's a lot of need for Latinos to understand this, and we get so much information out there that's so good. It breaks my heart and makes me feel good to see this young, older, well, not so old, and going out here looking at this, because I'm in my latter part of my career, and I really think it's exciting that we do this. So I'm looking forward to seeing this, guys.
Thank you so much. One last one.
So let me take the point up. It's Frank North, and I wanted to come up. So I represent the National Pharmaceutical Association, which is the minority pharmacy association, historically African American. So I wanted to, on behalf of our national president, Dr. Lakeisha Butler, just thank you and to let you know that we support you. We want you to support us. Our national convention chair is convention is in Houston, Texas, July 26th through the 29th. We want you to be there. So Dr. McCann's in the back. She's going to wave her hand. She's going to work it out. We're going to have a reception. We're going to have something to know that you all are here, because we want you to support us and we want to support you. I work very, very close with Chris Alvarado, who I just learned is on the board, so it's a winning team already. But I just wanted you to know that, and in any way that we can collaborate and move pharmacy forward together, we want to do that. Thank you.
Done deal. Thank you. Okay, last one.
Thank you. We've had a lot of conversation with deans and students during this conference of interest in starting student chapters being affiliated with NHPA. So what is NHPA thinking about? What have you talked about in regards to help them in doing that? Because the students, as we see with APH ASP, are great advocates in the community. They do get out and talk to the high school students and different partnerships to help grow for AP. Right, ASP, they could do exactly the same thing. So what have you been discussing in that regard? How can the schools reach out to NHPA for support in that?
So specifically about how can the schools reach out to NHPA to develop a student NHPA pharmacist chapter? So I'm glad that you've asked that. We've actually just finalized our student chapter bylaws and more to come. We are developing a comprehensive package that will guide the school step by step. From the minute we receive an email, you will receive an information sheet, just kind of how to move forward, what is the process. We have our bylaws. We're currently working on the requirements for the chapter annual reports. We're also planning on providing some guidance for our advisors. So we're being very thoughtful about this. Currently, I know that we're preparing to launch. I think it's going to be a pilot of about 8 or 9 student chapters first. So we're going to just sort of get up and running with these 9 chapters, really work out the kinks, really figure out what's working, what's not working, what do we need to change. And then once we have finalized our process with our pilots, the pilot student chapters, then we're going to go ahead and open the gates and welcome everyone. So we're very excited. Great question. All right, so I think that's all the time that...
Can I make just one comment?
Yes.
This is really important because thank you for the support. Just a key thing. I don't get too fragmented in the sense that you're working in silos because we're one profession. So as much as we can work together, support each other, support the profession moving forward, because if we don't have a unified voice to move the profession forward for provider status, sustainability, that is key. And when we start seeing fragmentation of groups, it doesn't help our cause. So I encourage and I welcome, hopefully if I win, like I hope you won't. But if that's one thing that I said that in the opening session yesterday, we have to work together. We're not in competition with each other, but we have to have a voice in these national organizations to help support this. So I'm very supportive of this, but together.
Doctora Elena Rios?
Yeah, I'm just so proud of where we're at. And Randy, thanks to you and Pharma and Walmart, we've been able to get this far. My name's Elena Rios. I'm president of the National Hispanic Medical Association and founder. We founded a National Hispanic Health Foundation so that we could work with all the disciplines. We started a scholarship program in 2004, and we have had a pharmacy scholarship program for the last couple of years. And I'm just proud that the organization now exists to be able to take on that scholarship program. And we accept students and hand over the database to the different organizations in our scholarship program. We have the National Association of Hispanic Nurses, the Hispanic Dental Association, the Latino Caucus of the American Public Health Association, and now the National Hispanic Pharmacists Association, and the National Hispanic Medical Association. So they each get the databases of the students. They decide by a ranking order of the students' success in terms of applicants for scholarships. And we actually bring the students and their parents to a gala dinner in New York City for the east of the Mississippi schools, and to a gala dinner in Los Angeles for the west of the Mississippi schools. And I just say that as an example of the interdisciplinary approach that we've taken. And when CVS and others asked us to try to figure out how to develop a National Hispanic Pharmacists Association, we said it would be a privilege to be able to find the leaders, first of all, that you see up on stage, and the board of directors, find the leaders who have the knowledge of the pharmacy journey and the challenges and the opportunities that it takes for the students in our communities. And I'm first generation too, and a lot of us are first generation. I went to Stanford University as an 18-year-old, full scholarship. I'm from Los Angeles, and my parents had no clue what I was doing and why I was leaving home at 18. But I left because I wanted to get educated. And honestly, I just knew that in all the schools in California, that was the most expensive, and you get what you pay for. I had no idea. But anyway, just to say that we are all in the same boat when it comes to the underrepresented students within our medical professions and healthcare industry. And we know that the Latino community is so important to this country that we have to have healthy students, healthy workers, a healthy military, and we need healthy leaders. and leaders who are Latino from your world, pharmacy, to help the healthcare policy of the country. And I'm in Washington, D.C. I've been there for 25 years. We do advocacy. We work with the top 40 Latino organizations in the country, and we know how important healthcare is and will be to the next presidential election. And it's so important to have leaders like yourselves to help us identify how to develop that advocacy among the next generation. And mentoring and leadership development is very critical. And I know that Maria and the board of directors and all of the leaders here are very enthusiastic about developing what they can in terms of white papers and knowledge and publication, research, but one step at a time. And I know that this year they're going to have the student chapters, the scholarship program, and for the professionals, some webinars to be able to start identifying the leaders. And for everybody that's here, thank you very much for coming. And we're very interested in working with all of you. And I think Maria and the board will just have to decide how they develop the collaborations, one by one. So anyway, I just wanted to say that we're very proud of being able to help as a fiscal agent for the National Hispanic Pharmacists Association. Thank you.
Muchas gracias.
Last thing I want to say too is, we'll probably won't be able to do this again because this is really the kickoff first meeting, but thank you, Dr. Rios and NHMA for stepping up, helping us put this together, and for the new board of directors. You're embarking in something so new that's going to get a life of its own and become something else. And I think everyone here, I'm personally curious to see what you do with this organization, the future of this organization. So getting it started was maybe, but it was easier than where it's going to go. So thank you, everyone.